Well, we gave you the story before. People can now collect chronic medication at post offices. The service is available throughout the country except in the Western Cape. However, with that being said, the Pharmaceutical Society is concerned that the Postal Service does not know how to keep drugs safe. So for more on this, we're joined now by the Health Department spokesperson, Mr. Foster Mahale, joining me this morning. Mr. Mahale, thank you so much for your time and good morning to you. Let's firstly talk about, the logistics around making sure that chronic medication gets to the people via the post office safe and sound. I mean, how secure is, of course, this arrangement, and why not in the Western Cape yet?
Thanks. Good morning to Melanie. Good morning to your viewers. This is not a new program. The program which we rolled out almost 8 years ago in 2014-2015 financial year. And it's not only, the distribution is not only at post offices, but at a number of retailers, your Clicks, your Discam, your Medrite, the independent and community pharmacies, your doctors' rooms and other places. So, and also want to allay the fears that these post offices and other places, they don't dispense, but they only distribute. The dispensing and packaging and labeling is done at our depot pharmacists. Then they get transported by the couriers who have got the capacity to transport medical products, which are like your DSV, your pharmacy direct. The role of these pickup points, we call them external pickup points, is for them only to issue. They don't do anything. They don't fiddle with this package, which is already readily packaged from our depot. Their role is just to issue to our patients, our customers, in order to reduce their time, in order to reduce the cost of traveling to their nearest clinic, their nearest pharmacy, their nearest hospital, which sometimes, in most cases, they are far from this area. So we're trying to cut this this cost from our customers.
Yeah, and why don't you have presence yet in the Western Cape province?
Look, yeah, Western Cape, by the time we rolled out this, they had already a similar program called they call it Central Dispensing Unit. So they've got a similar program. So there was no need for them to duplicate what they already had. So, and we are working closely with them. So there's no anything to worry about with regards to Western Cape. So they've got a similar program. So we are working closely with them.
Well, one council that is raising concerns that you're not working with them, Mr. Mahale, is the South African Pharmacy Council. They say they haven't been consulted at all with regards to the dispensation of chronic medication. They're actually not sure about how exactly they would be packaged, transported, stored, or even distributed by the post office. What's your relationship with the SA Pharmacy Council with regards to how chronic medication through the post office then will be distributed?
Yes, remember, as I want to emphasize what I said, that we are working closely with the Pharmacy Council as the regulator on pharmacy matters. But in this case, the Pharmacy Council is fitting with the packaging and the dispensation, which is taking place at our depot, packaged and dispensed by our pharmacists. Then the cold chain, like the distribution and the issuing at this pickup points, does not necessarily require any pharmacist. Just like any other courier, when you order something from your manufacturer, then there's a courier in the form of, there's a middleman in the form of courier, whose role is just to take the product or the parcel from the place of manufacturing to the place of the client. So here in this case, the Pharmacy Council, of course, they're playing a key role, but they're more concerned with the packaging, the labeling, and the issuing from our depot by our pharmacists, our qualified pharmacists. Then the rest are just the middlemen who are just issuing, transporting from this place in order to make it convenient for our clients to collect it conveniently without traveling, without going to wait in a long queues at places which are not necessarily closer to where they stay.
Yeah, but is there any reason for South Africans, with that being said, to be worried about, the post office ability to comply with the rules, I suppose, of keeping medication safe and secure? This, as already raised by the Pharmaceutical Society of South Africa. I mean, if a body of that stature could raise this as a concern, should South Africans join in those concerns?
Look, there's no need to worry. As I said, that we rolled out this program in 2014. And between 2014 and now, we've managed to enroll about more than 5 million patients who are receiving this chronic medication at our more than 2,800 pickup points. So there's no need for there's no need for the community to worry. There's no need for our stakeholders in the pharmacy sector to worry. All those who have got any fears, they can come to us. We can be able to tell us. We can be able to tell them on how we've decided on this. And in fact, we are even planning to roll out this at more pickup points, so that even those who are traveling to the further place to collect this medication can conveniently collect this. But also, what is more important is that it's not all out of thousands of post offices around the country. It's only few, about 300 of them, who have met these requirements, which include geographically and physically accessible. As we know that majority of people who are receiving this medication are elderly people, others who are staying in the rural villages and the townships. So we are trying to make it convenient. So the second part is the issue of security for this patient, for the patients and the staff, together with this medication that we are transporting to this pharmacy and other places like the post office, but also the issue of compliance with the rules and regulations that we require all these pickup points to be able to comply, in order to ensure that we don't inconvenience anybody, don't interfere with the business of these places, but also we don't have to inconvenience our clients.
Absolutely. Of course, thank you so much, Mr. Fosamhali. We'll leave it there. Thank you for talking to us and bringing some clarity with regards to, the rolling out of chronic medication to South Africans. They're saying this because they want to bring the medication closer to South Africans who cannot, for other reasons, of course, get it anywhere else. But the concerns raised about the security and safety of this medication, the department saying that is all under control. There's absolutely no need to worry.